I am. So you're going to give me the heads up.
Wonderful.
All right. Great. Well, welcome everybody to this wonderful webinar. My name is Joe DeVito. I'm one of the research coordinators here in the Center for mHealth and Social Media at the University of Connecticut. And it's my honor today to introduce one of our affiliate faculty members, Dr. Loneke Blackman Carr. She is an assistant professor of community and public health nutrition at the University of Connecticut. Her expertise is in behavioral weight control, interventions, and obesity disparities. She develops and evaluates interventions that leverage social relationships to improve weight loss and related diet and physical activity behavior change. Additionally, Dr. Blackman Carr's research investigates sociocultural factors that influence daily behavioral choices. And through her work, she aims to contribute to the development of more equitable solutions in weight control and physical activity interventions for Black women. She earned her PhD in nutrition, intervention, and policy from the Gilling School of Global Public Health at the University of North Carolina at Chapel Hill. And she's been a registered dietitian for just over a decade and was trained at Cornell University. So again, it's my pleasure to introduce Dr. Loneke Blackman Carr.
Thank you for having me, and it's such a pleasure to be here, and I'm thankful for everybody who has submitted questions in advance. I definitely look forward to that portion of our time today, and I say let's, no further ado, let's talk, and I will share my screen. All right, wonderful. So again, thank you for everybody taking the time out of your Friday to have this conversation. And I truly do consider this a conversation. So again, I welcome questions that have been submitted and even those that are to come. And we'll be talking about representation of Black adults in this discussion. And please feel free to also tweet some thoughts and questions. You can see my handle at Dr. Loneke down there as well. So I look forward to engaging even after this presentation on Twitter, one of my favorite platforms. But for today, what we'll really talk about, and much of my experience and research focus, as Joe introduced, is really surrounding weight and weight control. So I'll give many examples and kind of give us a preface or a background talking about obesity and as a public health challenge. But we'll talk about diversity related to weight control interventions as well, since that is my frame of work, and recruitment, thinking about barriers and strategies to address that, really understanding Black adults and who they are, give you some examples from my work, and really how do we move forward as a field talking about health research. So while many of my examples might come from the obesity frame, certainly as we talk about recruitment of Black adults, the strategies, the barriers, from what I've experienced, are certainly translatable across different areas of health research. I'm sure there are some nuances from some of your experiences, and so I welcome a future conversation about that. But let's jump right in and set the scene, really talking about the state of obesity, because this is really the premise for my work. We can see by the red circles indicated here in this most recent data about the prevalence of obesity within the United States among adults of varying race groups, that the prevalence rate among Black adults really is the highest. And so to your left or right, depending how you're viewing, you'll see that total category really does have Black adults at about 49.6% of the prevalence. But if we break it down by gender, looking at men and then women, we can certainly see that perhaps much of that figure and the disparity in obesity is driven by the high prevalence of obesity amongst Black women. But certainly as a nation as a whole, we can see that there is a great challenge that we do need to account for. But as we focus on Black adults, we should recognize that there is a disparity in high weight. And so therefore there is work to be done and much to be understood. Thinking ahead for what will things look like 9-10 years from now, Ward et al. In their 2019 paper talked about and focused on the trends in obesity, really breaking it down even into the different categories of weight. And so we can see here by this blue circle really indicating what will happen amongst Black adults. And so what I thought was notable here to mention is that the trends will be towards having the greatest prevalence of severe obesity, again, a BMI being at least 35 in Black adults. And that's just severe obesity. So we both have both moderate obesity and overweight as challenges here as well. So when you combine and look at all those categories together, certainly we can see that there will be a continuing trend of high weight as a significant public health issue among Black adults. And so that is just something to keep in mind. This is not a public health problem that is going to change unless we change something about it. And so this is really where investigators and our partners will be doing a lot of work and hopefully stemming some of this trend. Why do we care? As with much of our health research, it's of course all about the outcomes and disease and what that looks like for quality of life and longevity. And so when it comes to obesity, certainly that connection to type 2 diabetes, to increased risk of cardiovascular disease. And even in this modern day, we saw really clear connections between COVID-19 severity of disease and even the need for ICU treatment among those who had high weight, particularly those higher levels of obesity. So we know that obesity treatment and being effective in that route is important, not just for the prevention or delay of the onset of chronic disease, but also for being healthy and prepared as a population when acute health attacks do happen, and unpredictable ones such as COVID-19. So weight status and health are just important for both chronic and acute issues that are unforeseen. So with that in mind, we certainly want to look at our weight control interventions, and some of our milestone and premier ones include the diabetes prevention program. And we can look to see at these figures, how are Black men and women actually represented? If we are going to make strides in actually addressing obesity disparities and the related chronic and acute disease disparities that do predominantly impact Black adults, then we should see, okay, well, how are weight control interventions actually reaching Black adults? Within the DPP, we see the figures there. Within the weight loss maintenance trial, which did have a weight loss phase initially, we see that Black men are about 11.6% of that sample, women 32%. In look ahead, we had Black men at 9.1% and Black women in 20.1%. So these figures, you might say, okay, this is actually not so bad, maybe even favorable in some regards, as the population of Black adults within the United States is 13.4%. So in some respects, these studies, these multi-center trials do exceed the representation, but I think we all know within weight control interventions and many other areas of health intervention and research that reaching that 13.4% representation to just meet population levels and representation is sometimes hard won, sometimes a missed target, or oftentimes a missed target, hence the need for this conversation. But amongst weight loss interventions, certainly, it's been clear over the years that participants are mostly white and mostly female. In a recent study by Houghton et al. In 2018, and it was a systematic review, and they found that across all the studies they reviewed, nearly 60% of participants were white. But Black adults did comprise about 18% of the samples across. So again, we do see that there are some shining spots where we are getting greater than population level representation of Black adults. But this representation per those authors really only occurred when Black adults were targeted in that recruitment. So there's something to be said for really having focused recruitment approaches as we move forward in health research and obesity research. So what does that actually bring to us? That really affords researchers and practice to conduct subgroup analyses. Oftentimes, we might not see that breakdown by racial, ethnic groups, or even gender groups if that representation is not there, if the statistical power is not there to make that feasible. And so that certainly limits what the implications are to generalizable populations and who it might be generalizable to in terms of the results. But it also limits us in terms of being able to determine the efficacy of novel approaches. And we're always innovating in the health research space. But along with that efficacy, we might not see as robust effectiveness across subgroups. And we certainly, knowing that, want to be able to make modifications where necessary to really optimize and maximize outcomes for all participants. So diversity and that representation of Black adults will certainly allow for that when it comes to their health needs and concerns and outcomes. And then finally, I always like to keep in mind that how our research is funded, often, the funds we're going for are really taxpayers' dollars representing and supporting our research. And so our taxpayers should be represented in the research that we're doing, if we think about it from an exchange type of perspective. And so that diversity in weight control, particularly having the representation of Black adults, really does help us address multiple things and make our research more robust so that it will have, hopefully, more significant public health impact moving forward. And in terms of just weight loss, as really is my bread and butter and where I'm focusing much of my work now, we know that there's small to modest weight loss in Black women, often 2 to 3%, loss of their initial or baseline weight over a short term, about 6 months. But often that does fall behind or below clinical thresholds for reaching better health outcomes that relate to weight. But in terms of Black men, the challenge is a little bit different. It's more about that initial recruitment and getting them into the studies that is the biggest challenge. And you can see that evidence in some of those numbers I presented a couple slides ago. Black women were certainly more prevalent and more represented than Black men in weight control research. And so, but both of these issues will be benefited by having more representation of Black adults. And again, as we move forward, what does diversity in weight control actually get us? We'll be able to ask other questions, ask new questions that are actually novel, really understand concepts such as the social determinants of health, maybe even understand racism and what that looks like as a determinant of health when we have the representation of Black adults in our health research. So those contextual variables that really relate to the different behaviors we target that could impact obesity or impact whatever your health outcome of interest is, become really important and can only be realized when we do have that representation of a diverse population in the research that we do. So that is really the pathway. Recruitment is really the pathway and the start to getting towards more effectiveness for Black adults. And hopefully, as more novel solutions come about, greater efficacy as well can be realized. So in doing this work, I think it's most important to always understand the population we are engaging with. So in terms of Black adults, I really wanted to share with you who are Black adults when we say that we want to target them and include them in our research. Let's take a look at who they are. Again, we did say that they're 13.4% of the American population now. What that represents over the past 21 years is 29% population growth. So we have seen the population grow a little bit, but it should be well known that Black adults are not a racial or ethnic, or not an ethnic monolith. So they can certainly be multiracial. So it's, or single Black in race in terms of how that they identify. And then they can also identify as Hispanic Latino. So being Afro-Latino, certainly people can wear both identities. So we do want to recognize that Black adults are diverse in and of themselves. So that is something to keep in mind. But additionally, immigration status is something to keep in mind because about 10% of Black adults are foreign born. And that does represent about a 3% increase over the last 20 years. So we do see these kind of changes, and it's important for us to understand that. So as we do look deeper and deeper into our research and are successful in recruiting Black adults, we know who is there and who it actually does represent, so that generalizability can be really specific and really targeted in terms of what our research will produce and who it would impact. So another fact about Black adults, and this comes from the Pew Research Center, is really about where do they reside. So this map is excellent because it really makes it very clear where Black adults are residing. And so the southern part of the United States, we see above 50% of Black adults live there, with the Midwest and the Northeast being the second most populated places in terms of Black adults, 17% each, with the West being about 10%. And so when we're thinking about, well, what are the possibilities for our research, for our clinical practices, for our public health, you can clearly see, where there might be somewhat greater ease depending on where your work is situated. Importantly, other factual things just to give us a sense of this demographic, we can see again from the Pew Research Center and their analysis of census data, the median income for a Black household, is about $44,000. But as the title does imply, nearly half of Black households earned $50,000 or more in 2019. How are Black adults actually in relation to each other? So we can see that more than a third, almost 40% of Black people live in households headed by a married couple. 32% are in households with a female leader and 6% with a male lead. And so again, just characterizing that we do have cohabitating couples, of course, who are married, and you can see the different ways that households are led and oriented in the Black community as well. And another fact that I think folks, especially in the public health space, are really knowledgeable about is that Black adults are a highly religious group. And the Pew Research Center did do really excellent work in terms of really breaking down what does religiosity and faith look like in the American population. And it became really clear that Black adults are the most highly religious group in the United States. Part of that is certainly their belief in God. The majority of Black adults do believe in God and are vocal about that. But it's also reflected in their high engagement with the church and in their faith communities. So when it comes to attendance, being engaged in the church on a weekly basis, this is certainly a reflection of how connected Black adults are to their church. So that continues to be a social institution, a venue, a cultural center that is in the Black community and very important. But it's certainly been for a long time a common site for health promotion. And so its relevance continues for the Black community. But getting to almost the meat and potatoes of what we're truly interested in, we want to know what's in the way of recruitment. Really, what are the barriers that make it challenging for Black adults to be part of our research and part of health promotion? Transportation is one of those barriers, as you can imagine. So we want to keep in mind, are we still expecting Black adults to come and find the research, or is the research going to Black adults to provide solutions and to really help understand and answer those important research questions? So we need to go to the populations we're interested in. Work and family commitments, not so surprising there. I'm sure many of us can identify with that as a barrier to engaging in anything extra in our lives. Lack of time is part of that. And then finally, lack of familiarity with clinical trials. And so this is certainly an area we can do a lot of work in how we communicate and science communication about what clinical trials are. And certainly we can think about the historical mistrust that has really been brought to light because of COVID and the COVID vaccine. And so that's been part of the conversation, though it's not all of the reason why vaccinations have been challenging to disperse throughout diverse communities. But it is part of the history and understanding of clinical trials and the benefits and risks to that from the perspective of Black adults in the Black community. So what actually works? Evidence is out there, though much more could be done and published on this matter. But what we know can work for recruitment of Black adults is certainly mass mail distribution. This is pretty general of a strategy, and I'm sure many of you have employed it before. it is helpful in reaching individuals, but perhaps not the most effective strategy all the time. What does work is targeted messaging. So really appealing to Black communities, representing them in both their gender and their race and their diversity. As I mentioned a little earlier, and we saw some statistics about who Black adults are, identities are varied and Black adults are not a monolith. So making sure that your recruitment materials, your messaging actually reflects that diversity in Black adults is going to be important so that they do feel like you're speaking to them and the research that you're hoping to engage them is actually going to be relevant. So you need to understand who they are and their identities in order to do that. Having a diverse research team is also important. And I think this is certainly part of the trust building portion of the recruitment process. And so when, again, that representation is not just in the samples that we're hoping to engage with and become part of our research, that can also be facilitated by the diversity of your research team. So are there people who identify with or reflect the target population on your research team? Not only is that beneficial from solely an identity or visual perspective from the eyes of the people you hope to engage, but certainly the members of your team who come from those diverse communities may be instrumental parts of actually reaching those communities and understanding them. So while it's important not to make the assumption that your diverse research team members do know that community, it is important to do that work, even if your team is not diverse, to understand who it is you are aiming to engage with and asking yourself, does my team actually reflect the communities that I hope to serve? If not, then it might be time for some, team conversations and figuring out how do we actually create that diversity within our team? Is that feasible? And how do we go about it? And then finally, really establishing trust. And so part of this is certainly the presence of the PI, which I know can be challenging because so much is asked of the principal investigator. And the role, is really to administer and manage and come up with novel ideas. So where you spend your time can be really challenging, but actually being a presence, being known to the participants that you or potential participants you hope to engage in may help move that needle to get them through the door saying, well, I've met the lead of this project. I know them. I know what they're about. And along with that is actually communicating well the study risks and benefits. Much of this happens, through our IRB approved research, making sure that our consent documents and informed consent processes do happen, but taking that extra step to really understand and make sure the communities you want to work with understand what research is, that they are engaging in research, of course, but also what are the pros and cons of doing that, and answering any questions until there are no more questions on the table will all be part of that. But knowing the research team, seeing that diversity, and having the presence of the principal investigator are all strategies that can be helpful in recruiting Black adults. Additionally, community partnerships are perhaps one of the greatest ways to support diversity and continuous diversity in your research. But I really encourage anybody listening to focus on community partnerships that have aligned health missions. And so really you can think about civic organizations that focus on the health of Black adults. And that is far and wide in terms of who does that kind of work. You have sororities and fraternities that do that work amongst young adults, to older adulthood. Certainly the church and churches that are predominantly Black often have a health ministry, and that's an oldie but goodie, but it is still relevant. As I mentioned, Black adults are a very highly religious group. So really fostering and seeking strategic community partnerships and making sure that you are doing that exchange, that they have equal power in this relationship of, what it is you hope to achieve with that representation and also what you're giving to them. And so I think that relationship building is going to be a sustainable thing that can carry your research forward with that diversity and future generalizability you hope to achieve. Sociocultural outlets. So by this, really we're talking about outlets where the population that is targeted to be reached is Black adults. So what are their radio venues that they focus on or gravitate toward in your locale? What are the social media outlets where they really live and engage with? Pew Research Center has a really great report about social media engagement and who engages in that particular social media outlet, whether that be Instagram or Facebook, YouTube. I would highly recommend downloading that report because it does give you a very nice snapshot of the different race groups and how they engage, and even by other demographic factors such as age. But last on this list on this page really is word of mouth. Do not underestimate the power of word of mouth, because really it's an endorsement of what you do and what you represent. And so whoever is in the social network of the people you hope to reach, that word of mouth can be a powerful asset. And you can really leverage word of mouth even through your past participants. So digging back into who's engaged with you previously can really be a pathway towards engaging with those individuals you hope will be new to your work, and maybe even, if appropriate, engaging those past participants as well. But word of mouth can really power and be a support to that trust that you hopefully have built and rendered over the years. Now, what I'd like to do is just give a couple of examples from a past weight loss study that I conducted in about 2016, 2017, called Sisters in Health. And it was focused on Black women exclusively, really to address the obesity disparities I mentioned at the top of the hour. But some strategies that I found particularly helpful here were community partnerships. This was something that I knew needed to begin far in advance of the upcoming study that I knew was being planned. So having intention about what you want to accomplish in the community, what your relationship with communities will be, is really foremost in securing and supporting future recruitment. So again, I took that same research advice and focused on civic organizations with health missions. I focused on long-term relationship building and saying, okay, well, I'm here in the community and my talent, my purpose is to focus on health. And these are the health outcomes that, I have focused on, but my talents are available to you. So really taking that perspective of service. And I found that to be a helpful perspective to take as I'm communicating and working with building relationships with community. And so that bi-directional relationship of here's what I can give you, here's what my lab is able to do, whether that be workshops, whether that be information that we're privy to, often as part of university systems that the lay communities don't have access to. So we can really be conduits of communication and information, and factual information at that, really myth busting and clearing the air for those different health outcomes communities are really interested in knowing about. Another strategy I engaged was with predominantly Black churches. And so that had health ministries. So really engaging in their community events, again, just being a presence without asking for anything was important, just to build that familiarity and getting to know who, were in the positions that were serving the health needs of their parishioners and responding to that. Of course, part of being successful in the church medium is having supportive leadership. So do you have the buy-in of the pastor? Can you get to the pastor through the secretary? Every organization has its structures. And so understanding that the church structure is important, and who it is that will be helpful to you, such as the health leader of the health ministry or the pastor, should you want to reach the whole congregation. And so again, this is really where bi-directional relationships come into play and are important. So what are you giving? But also, in exchange, you're hoping that you've built enough of a relationship that knowing about your research, what you do, and your purposes for that are going to be of interest to that church community. And then word of mouth. Certainly, I led a small pilot just to test out certain aspects of the weight loss trial before launching into this larger trial. But really, having past participants give testimonials about their experience, if they felt it was positive, was helpful. Really having their picture, if they consented to that, with that testimonial really allowed me to have targeted recruitment through this study as well. And then radio, which sounds somewhat old school because we can stream everything these days, but radio continues to be a great resource that can reach your target audience. And so, again, building that bidirectional relationship with those individuals who lead those radio programs was helpful in this regard, and helpful for the community to know my name, to know that I exist, and to know what my purpose here, and that I am a resource for health. And so really establishing what your value is as a community member yourself, even though it is also your profession and, you know, how you put food on the table. So just a little visual here of the community information packet that I had prepared. This was a several-page document that did the work of helping communicate the risks and benefits of the research interested persons would be participating in. So really allowing me to debrief about the study in information sessions. And by being present there, participants were able to ask the leader of the study, the PI, anything they really wanted to. And so that certainly led to robust conversations. It led to personal connection that was, I believe, really instrumental in gaining and starting that trust relationship. Now, currently, I am working on a diversity supplement with Dr. Gary Bennett at Duke University. And this collaboration with he and his team has been great. And it really focuses on recruitment into a digital intervention that's focused on the dietary approaches to stop hypertension. So my work here and what I'm adding is really investigation into the different recruitment methods that are appropriate or of interest to Black adults, men and women. And so the data analysis, or aim one, which is purely qualitative, is underway in terms of the analysis, but has been collected. But some preliminary observations of where Black men and women say they can be reached in terms of where do we place our ads, how do we target you for recruitment. Social media was certainly brought up and across different platforms, but Facebook was certainly in there, really focusing on organizations that are focused on Black people. Again, so that includes the civic organizations that I've mentioned beforehand. The church continues to be relevant. But as in this targeted messaging, participants also really, what we're seeing emerging is that they want to see themselves in the messaging, in the ads. So are we showing, you know, other Black adults who don't have the quote unquote perfect body type as part of the recruitment package? Are we seeing families? Are we seeing people who look like them in all the different ways, engaging even with technology, since this is a digital trial that we're trying to get their input on? And so we'll continue to analyze this data, but that's just some preliminary observations that we're seeing that I believed would be important for this conversation, because this really is all about nutrition, and we are talking to Black men and women who have hypertension. So you can kind of see there's a repetitiveness and an application of the same strategies that can work, whether we're talking about weight control or whether we're talking about dietary behavior change, even to address hypertension. All right. And so digital recruitment is an area of opportunity. Much of what I said could be accomplished in person, and there's certainly a place for that. But the digital realm is here. It continues to expand and offer us endless ways to engage. And so as an opportunity, we know that more than 90% of Black adults engage in the internet. So there's high saturation there. And almost all Black adults own a cell phone, with 83% of adults having a smartphone. So this digital divide in terms of how folks are engaging with some digital technologies, we really aren't seeing disparities there. So this is an area where recruitment really can be robust and should be included. Recruitment of the future, in my mind, really is a combination of those digital realms that I just mentioned, but also the tangible and in-person things where you can shake a hand. And hopefully as COVID works itself out of our social system, we can get back to shaking hands and feeling safe about it. But really, again, continuing those same trends of targeted recruitment. So is the imagery engaging and reflective of the population? Is the messaging doing that same thing, really representing who you want to engage and doing it properly? So we want to maintain those in-person methods, even though they may translate to a digital space just fine. So establishing your presence in the community, you can certainly establish a digital presence, especially through social media. Continuing to do that relationship building with civic and community serving organizations, the church that's predominantly Black. Diversify your research team and make that really a focus of your agenda. And building trust, which comes over time. So really thinking about that trust building relationship as something that is continuous and needs to happen not just when you're planning your next study or your next clinical endeavor. It really is a continuing conversation, a continuing relationship of give and get from both ways, but also acknowledging the power in the community and the power of what you contribute as well, and sitting, in both in shared power when it comes to that. So really taking a little bit of a community-based perspective on how we build trust and what's important to the community will help facilitate recruitment down the line. And so as we continue to think about what recruitment might look like in the future, really listening to the community is going to be paramount. So be observant for what those local initiatives are. What are the areas of need? Really, as simple as it seems, looking at the small papers and publications that are specific to the Black community can be really helpful ways to see what's going on the ground here, what's important, and can my work or my research in any way be a benefit or a help to this social issue or to the opportunities and changes that may already be in progress. Also, think about engaging in various ways. As I mentioned, we have the digital realm matching and even potentially translating some of what we've already done in person when it comes to recruitment. So just a couple of examples from the past couple of years, as I've come to a new community and relocated, kind of having to start this community building all over again. But really thinking about, okay, I've been lucky to connect with community leaders who have podcasts. So talking on topics that matter to their listeners, in this case, this Rich Answers podcast here, really speaks to the Black community here in Connecticut. So talking about food and nutrition and things that matter to them was really fodder for opening the door for them to know who I am, but also what I can contribute to the community. Giving workshops at local churches are certainly things that I've done, especially as a registered dietitian. This is always a hot topic to talk about food and the concerns and even some of the misinformation that is out there. So again, that establishes the PI and the research team as experts and trusted experts who are here, that Black population can, so to speak, lay hands on, but at least lay eyes on for now. So continuing to do those kind of workshops, making myself available, asking what does the church need? How can I be of service? Has continued to be a strategy that works for me. And finally, just being at community events. Again, even if it's passive, people start to see your name and relate it to what you do. And it's another way to gain exposure in a passive way. So continuing to build your presence and your familiarity with the community, with the different events that go on, will really strengthen your ability to recruit Black adults. What does recruitment of the future look like? Now, this is perhaps one area that I think we can all do some work in. If you're not already, if you are, kudos to you. But what we need to do is really capture our data on recruitment. It's a process we all have to go through to create our programs and make sure they're robust. So we might have that data somewhere. Maybe it's in an area that you can dig it up and write a paper on it. But it allows you to really assess the effectiveness of the different strategies you've employed. So really treating this recruitment phase as research in and of itself before you get to the other research questions and the health outcomes or implications you're interested in, really assessing your recruitment strategies, if they're truly reaching who you hope to reach, and if so, what are the best ways that that's happening so you can continue to repeat that success and potentially also strengthen areas that might be weaker than others. And then finally, publishing that data, because data is all great, but not unless it actually gets out and tells the scientific and the public health community. So publishing that recruitment data will be a help to those who come down the line. And there is more work that can be done for us to understand, how do we actually recruit Black adults? What's the best way to do that? Because I do know in many conversations, it continues to be a challenge for researchers, but I don't think it has to be. And I think there's much more success out there that we can really be building upon. So let's do that. And I encourage everybody to publish a bit more in this regard. So with that, I'll say thank you. And certainly, again, please feel free to email me. You see my email there. But I also welcome tweets so we can have some Twitter conversations on this topic of recruitment. And I know many of you have submitted questions in advance. So I'll invite our moderator back to open the conversation so we can talk about some of the questions that you have. But I thank you in advance for your attention, and I look forward to continuing this conversation.
Great. Well, thank you so much, Loneke, for an awesome talk and very informative, which I know will be very helpful to the research that our group does. Certainly. So as you said, yeah, we do have quite a few questions that were submitted ahead of time, but one did pop up that looks like was a popular question. A few people jumped on board as well on the feed here. So we'll start with that one. So I think when you were talking about your Sisters in Health study, you had mentioned sending around that like community information packet as sort of a way to prime potential participants and sort of announce your presence in the area. And so people were looking for if you could explain a little bit more what was included in that packet.
Absolutely, and I'm glad to do that. So in that packet, I mentioned it's several pages long. So really it is a detailed explanation with both visual and text content about what this study is, what it aims to do. Of course, being clear that it is research because that's really required of us, as we adhere to IRB protocols and ethics, but really detailing, well, what is research and why should, our individuals, our Black adults care about it was part of that community info packet. Additionally, what would happen in this study? So really kind of laying out the timeline. So participants or potential participants understood the commitment in terms of timeline, because of course, depending on the intensity of your intervention, there's always a commitment. We do want that, assessment data that comes next after they sign up. And again, really detailing, here are the risks to you, here are the benefits. So a lot of that does reflect in that community info packet, reflect the informed consent process, but putting it in a way that or in a visual way that was just a little bit more friendly to read, digestible than just the basic black and white of an informed consent document most of the time. So yes, that was really the focus of that community info packet, along with information about the team. So who was actually involved in this research study? So it told about me and who I am and, really my motivation for doing the work. So any opportunity I had to say, okay, well, here's who I am, here's why I'm here. This is in some regards, especially when you can sense that there's mistrust, saying, this is why I'm not here. This is what I'm never going to do. So kind of really opening up that conversation to your values as an investigator, again, helps to build that trust initially.
Great. Yeah. And that's, I think, what some people speculated here on the comments about, for example, like, this is what we're not going to do with biological specimens if we collect them. And so that's great. So another question we had submitted I'll just sort of read it in its entirety. So I'm planning to connect with Black women for my mixed methods dissertation and focus on the experience of weight stigma, eating disorders, without official diagnoses, weight control behaviors, treatment healthcare intentions and experiences in social support seeking. So this person says that I hope to look specifically at the experiences of Black women, but be sure that I have a diverse representative sample of weights and body sizes. But I am concerned that this will be very difficult, or a very difficult population to, one, gain the trust of as a white woman researching a topic that is always focused on and privileged thin white women. And two, I know that for my dissertation, I will have to be the one interviewing. So how to best sort of navigate that dynamic.
Yes, I really appreciate that submission. So thank you for that question. Really, I think there are two important things here to keep in mind, because certainly when it's part of your dissertation, you're often not working with a lot of money. So hiring somebody, who might be race matched, which may or may not be helpful, is not really an option there. But the two things that I come to mind for me with that is, one, owning your whiteness, if I can put it that way. So acknowledging, hey, I'm here as a white woman who's interested in this. I know, and say what either deficit that actually puts you at, right? I know I don't understand your experiences. And that's, part of the motivation or impetus for the work that I'm doing. I know that there is work that needs to be done here. And so I think owning your whiteness is going to be very important in saying what you don't know, but also putting out there what you are capable of, right? What your skill set actually does bring to the table. But I'm capable of, taking my talents and understanding and telling your story, and understanding your experiences. The other part of that thing to consider with this question is that as we're talking about, potential eating disorders and things of that nature, the representation of Black women is really not where we want it to be. And I did a talk about that some time ago with the nutrition and dietetics group. And so I think part of the challenge will also be just identifying Black women in this topic area, because it's really not a topic that's often discussed. And folks may not even know that they do have, some maybe disordered eating or abnormal eating habits and patterns and, things that may or may not relate to their weight status. And so I think that will be certainly a challenge, as the submitter recognizes, that will potentially mean, I feel like strategies such as word of mouth will be really important. So once you find one or a few Black women who do identify or are part of this, you might need to really leverage their social network, if you will, and see if they're willing to, if they feel like they've had a positive experience with the research you're doing, be that, beacon and connection to the next woman and the next woman. So just keep those two things in mind as you move forward. And yes, there will be challenge. I think that's the nature of research in general, but I also think much of it is coming as who you are, owning your identity when, you especially perceive there might be some challenge, and that is an important factor there. And just walking in that, but go do the work now to understand and find out those circles of women, because it is going to take time if you haven't engaged with this population, especially on this topic before.
Awesome. Great. Yeah. And so obviously that question was very focused on, Black women, but to touch on that topic, do you have some suggestions for gender specific strategies, whether that be just for Black women or just for Black men when recruiting? Is there anything that you had employed specifically?
I thank you for that question. So I'll own it and say that most of my experience and work is with Black women. So anecdotally, I've observed with colleagues who do work with and engage Black men in interventions, that often the way to Black men is through Black women or through their partners. And so it's kind of this circumventing, if you will, the woman in their life who will stay on them about, okay, this is really important, you should do this, and help to be a convincing partner in that, or a motivating factor. So I think for Black men, that's really part of it. I do think there's, some mistrust there as well in terms of, just trust of clinical research and medicine. And so those are just hurdles we're going to have to continue to figure out ourselves. But really, gender specific, I think for women, it's always a little easier to engage women in health research than it has been men. And that's been my experience thus far. But I'm hoping with the work that I'm doing now, I'll understand a bit more how to reach men, and that some of those nuances in what men want when it comes to recruitment and what women want will actually come out. So I look forward to analyzing the data I have now relating to my nutrition study and publishing on that to share with you all. So stay tuned. Might be a future SBM publication or presentation in 2022.
Great. Yeah, I like that answer of the way to the men is through their partner. So that's great. And another question, and this one I know is certainly very helpful for our group, as we do a lot of nationwide recruitment for studies. And it sounds like a lot of what you've done has focused more on communities and building trust within your, geographic community. But what strategies can you share for trying to recruit a really nice, diverse sample nationwide, and what strategies to employ versus maybe back off a little bit?
Sure. And I feel like this is a growing area of expertise for me as well. But I will say my number one resource for engaging a diverse sample of Black men and women has actually been Research Match. And I'm not sure if that's actually present at every university, but I encourage people to ask for it. And so really what it is a platform to connect with individuals who match different demographic factors that you're able to set. And it has been a really great help actually in recruiting Black men for my qualitative study about nutrition and recruitment for those who have hypertension. And so Research Match is something you should definitely look into. And I've really gotten great engagement from men across the country. So Research Match is one way, but I think the digital realm has opened up a lot of options for us where, social media can potentially play a role. Many of those civic organizations, again, whether that be organizations focused on civil rights or organizations focused on that are Black and Greek life type of fraternity sororities, those are national and sometimes international organizations. So don't count those out. Those are strong networks that do span East Coast, West Coast. So definitely think about civic organizations as a strategy for partnership that would be helpful. And so not only do those civic organizations have both local ties, but those local ties are often connected to a larger hierarchy that would be national.
Definitely. Yeah, we've really enjoyed and relied on Research Match to meet, the targets we'd set for ourselves in our research. So I'll second that it's been very helpful. And sort of to build on that question, a few people are asking about how do you build trust through that online recruitment? So how do those strategies sort of differ?
Yeah, I think so. This is challenging, I think, building trust online, but something we will continue to have to maybe muddle our way through now. And it'll be a somewhat of a new experience for me too. So I will say the caveat about Research Match, and perhaps something to keep in mind, is that the people you'll engage with are people who perhaps are already primed and certainly aware that this is a platform for research, and they'll be sent communications about research that actually matches their demographics or their interests. So in a way, I do think that population is primed for research, and they might be somewhat different perhaps than the general population for that reason. I haven't done that research, but that is my kind of educated guess there. So that is something to keep in mind. You're not really building trust through the Research Match platform. But where I think we can build match in a digital world, trust, in a digital world, is really taking what we do in person and bringing it online. many of those venues and outlets that I talked about we can engage in a digital way, the church, for example, they now have online church services, which is, not quite a super new thing, but more and more churches and whatnot are moving in that direction to engage parishioners in person and online. So really, the workshop that I did locally, is there an online venue for me to do that with you all? But I think there's also something to be said for building your own content to a certain degree and making yourself, your lab, a community resource. So there is where you can, in my mind, take advantage of social media and build your presence there. And that is actually one strategy that I like to employ in my lab and hope to do more of in the future, because of course the undergraduates and even graduate students on my campus are more savvy and more on the ball of what social media outlets are really popular. They really know how to use them so much better than I do. But building that presence is a way to, build trust, but I would say more so build expertise, right? So that you're at least capturing people who know, okay, well, I go to Dr. Blackman Carr and her Twitter or her Instagram page when I want nutrition information or things related to Black women. And so I think that opens the door for that invitation for potential participants to walk through and learn more. But I do feel like, I'll be doing some more work in figuring out how do you really get to trust through the online way. And I think a lot of that is putting out your own content and letting people know who you are.
Yeah, definitely. I agree, I think the one thing, hopefully if you can establish yourself as that expert and gain that trust, you won't run into this issue. But I guess sort of the last question, which maybe is just one to muddle on, and it's something, again, that anybody who does research online does grapple with, is how do you know, is someone online, how do you know who they are, who they say they are? That question that came up here in the chat. And sometimes one that we ask ourselves sometimes as well. So.
Oh my goodness. Yes. I feel like this is an evolving challenge now that we're in the digital age, and so much happens without us having that in-person connection. So yes, there's kind of that trust element that, people are who they say they are. But depending on how you do your assessments, maybe you build in a video type of portion of the run-in part of your study before it truly launches, right? So there's some connection between the individual and the research team. And so that might help you navigate around that. So again, if video isn't something they can do, again, depending on your study type, depending on their technological access, maybe it's a phone call, things of that nature. So kind of building in those connection pieces will be important. Of course, depending on the size of your study, that could be very time consuming. So certainly employing many undergraduates and graduate students in that work to help facilitate that will be important. But I think, as a creative way, building that into your run-in phase before you really launch in and get informed consent and all those things will be a helpful thing. But there is a little bit of, confirmation that maybe can't always happen depending on the shape of your study. So I look forward to reading more and more of the work that I hope listeners will publish on to help us figure out what are the best strategies to confirm identity, to build trust in the online space. So this, again, is why I was calling for, let's do more. We've done the recruitment. We have these studies. If you have the data, go ahead and figure out how can I publish on this and really help move the field forward in this regard.
Definitely. Yeah. And we'll be hosting a webinar actually on that topic a little bit later this summer with Dr. Daniel Jake Schaffman from the University of Florida, talking a little bit about, that run-in period and how to sort of really, build that trust and strategize around that question. I think that brings us to the end of the webinar today. And I have to really, thank you on behalf of Dr. Pagoto and our center. Thank you so much for a fabulous talk. Really, really informative. And I think one that will benefit a lot of the research here at UConn and, around the country. So I really appreciate your time today.
Thank you, everybody. And again, I hope to see you all on Twitter, and I look forward to attending that future webinar and learning more myself. A scholar is forever a student. So I'm always happy to engage in these conversations.